Good. I've got a good one for you today. I've got an excellent interview. It's a featured article for our 2025 lifestyle goal, Mommy Makeovers. With me today, I have Dr. Andrew Ray with Southern Surgical Arts. It's southernsurgicalarts.com. Phone number is 800-950-0492. And let me just say up front, 18,000, over 18,000 cosmetic surgical procedures performed at the with Southern Surgical Arts. So, Dr. Ray, pleasure meeting you, sir. How are you doing on this day?
Hey, the snow finished snowing and the kids have been out sledding. We've been active, so it's been a great weekend so far.
Beautiful. Glad to hear. And again, thank you for your time. Let's dive right into this. Again, Mommy Makeover, 2005 or 2025 lifestyle goal. What is a mommy makeover?
So the beautiful thing with a mommy makeover is it can be anything that you want. The typical in this world is something typically with the chest or the breast, some form of liposuction, something with the abdomen. Why is that? Because most women, whether it's because of pregnancy or weight loss, they have a lot of changes in their breast and their abdomen, and they're looking just to recuperate kind of what they had prior to donating their bodies to, creating something or getting through a life process.
So essentially, what we're looking at is this is a customized procedure then.
Yeah, 100%. Because some people, their priority could be their arms in their belly, or maybe their legs in their breasts, or maybe their neck in their breasts. So a mommy makeover can be anything that you want it to be. That's a combination of multiple surgeries. Basically, the term from an industry standpoint is any surgery that combines multiple surgeries all at one time.
So I know the answer to the question, but it's not a one size fit all procedure.
No, never. It's, the lovely thing about the way I conduct my interviews with my patients is I always ask them, what are you looking for? How can I help? Because
Right.
the big thing is what is their vision for themselves? And then from my job at that point is to say, okay, here are your options, A, B, and C to accomplish what you want. And also to go over, reasonable expectations, risks and benefits and all of that with the surgery.
Excellent. Excellent. Here's another good question for you. Who's a good candidate for a mommy makeover?
Just about anyone. So I get a lot of women that are in their 50s saying, "Hey, am I too old for a mommy makeover?" And absolutely not. The biggest thing, undergoing the surgery is, are you healthy? Obviously, if you had a stroke, a heart attack, have major medical problems, no, this isn't the surgery for you. But if you're otherwise healthy, I've done mommy makeovers, and they can be grandma makeovers too, and with women in their 60s. But most women that have this procedure are between probably the ages of 25 and 55.
Okay, so for the most part, you answered my next question, but are there any pre-qualifications for a mommy makeover?
The biggest one in my world is beyond just medical health is smoking. So nicotine can cause
Ooh.
a significant decrease in blood supply. So anytime we're doing a mommy makeover where we're shifting a lot of skin around, we don't want to compromise the blood flow, and nicotine does that. So we ask that all of our patients are off nicotine for about 6 weeks before surgery, and obviously at least 6 weeks afterwards, though we have no control over that. That's the biggest one, is just no nicotine.
Okay, good. And then how long is the downtime? I mean, that's always my concern is, the downtime, and then what's the recovery plan?
Yeah, so the recovery plan, honestly, if you ask 10 surgeons, you're going to have 10 slight variations to the overall plan. But
Yeah.
for my patients, when they come to me, is I say, you won't like me too much for the first 5 days, but I use a 3-day numbing agent, multiple non-narcotic pain medicines to control the pain. Most women feel like they can resume some of their mom duties at about a week, but I tell them, hey, plan on a week where someone else is doing everything, making food, doing bath times, getting ready for school, all of that. And after about a week, you're good to go at that point. And then most women, if they work outside the house, if it's an administrative job, around 2 weeks out, more of an active level role, like a nursing job, 3 to 4 weeks out.
Excellent. Now, we're all, and I say this in a general format, but we're all looking for immediate gratification. How soon before we can see noticeable differences?
Well, it depends where you're at when you come in, right? So if you come in and there's an abdominal flap or maybe a hangover, a prior C-section scar, that's immediately better, which is a really nice thing to see. But there's a marshmallow phase. So I say, day one after surgery, you look great, enjoy it, look in the mirror, good. And then you're going to have what I call the marshmallow stage after that, which is where the swelling kicks in after the liposuction. And you probably won't see great results for another 6 to 8 weeks, but the skin is going to be gone. You're going to have a more svelte core. You're going to be able to see some of the curves. You just have to get through that postoperative swelling stage. And then it takes a full year for 100% of the results to get there. But by week 6 to 8, you're really starting to see the results. And that's when I tend to get a lot of text messages from my patients that say, "Oh my God, I love this." And they start sending me all the pictures. It's really lovely.
So it's also involves aftercare too, on the
Yeah.
responsibility of the individual. I mean, you just can't, you have this procedure and then go back to doing nothing too, right?
No, yeah. I mean, and the beautiful thing with the people that I have the opportunity to work with is that most of them are on a journey already. So they're
Already.
motivated. They've changed their lifestyle. They're eating well. There's typically some form of activity that's really become a part of their life. So just continuing that after surgery is great. But yes, I say, within 15 pounds, 20 pounds or so, the results are going to be there forever. It's when you gain more weight than that that some of the results from the tummy tuck and liposuction start to get a little blunted. Not gone, just
Sure.
not quite as fine as what it is right after surgery.
Good. I know this interview is helping me a lot just in my household. I mean, my wife mentioned to me that that was her lifestyle goal for 225. So I'm happy to hear that. Dr. Ray, I always ask, what's your why? Here's an opportunity for a closing statement to plug your practice with facilities in Calhoun, Georgia, and also Chattanooga. Okay, we're Georgia Business and Lifestyle magazine. We push everything Georgia.
Yep.
Um, what motivates you? What's your why?
So, and I primarily operate out of our Calhoun location. I'm down there 4 days a week.
Excellent.
The biggest thing is it's never the location, it's never the practice itself. Yes, obviously you want it to be safe, you want it to have a good record,
Yeah,
etc. But the reason I do this is I love recreating anatomy. So if you look through my stuff, I am much more how to find what there was before, whether it was kids or a weight loss journey, and how do we get back to that. So I love seeing before pictures of all of that. And then I love the surprise ones where a woman will send me pictures of them after surgery and how close they look to what they were before surgery. Now, I'm not God, I can't do that. But the
right.
goal is not to enhance or to project unless someone's really looking for that, but just to recreate a functional anatomy that's close to what they had before everything was done with the children and whatnot.
Sure. And I'm sure, like most women, they're looking for version 2.0.
Yeah.
So I have a lot of admiration and respect for you, doctor. You're an artist. No, you're not God, but you're an artist. So,
Yeah, yeah.
yeah,
And that's the beautiful thing about this is it is a lot of really intricate movements within surgery. I actually just got one of those TikTok hand massagers because I was finding at the end of some of these really long cases that my hands would get sore, and now I get to get a little massage at the end of most days.
oh, nice. Oh, nice. Excellent. Dr. Ray, I want to thank you again. SouthernSurgicalArts.com. Telephone number is 800-950-0492. Please visit Dr. Andrew Ray. Thank you so much for your time, sir. Much respect.
Hey, this has been a pleasure. Thank you so much, and I look forward to chatting again soon.
Excellent.